Hello, my name is Dola Biodun. I'm a DNP psychiatric mental health nurse practitioner at Brahman University, and this is my signature assignment on integrative therapy video. This case is about a 23-year-old African American male that is a current college student who lives with his parents and two brothers. He has a history of major depressive disorder for 1 year, and due to COVID-19 pandemic, he has not been able to get a job. This patient has a core belief that he is not liked by people, and this translates to negative automatic thoughts of I'm not good enough. He feels that since he's not good enough, he would not get a job. So the three complementary psychotherapy modalities are picked from cognitive behavioral therapy, that's the CBT. And these are the self-talk, the Socratic questioning, and the self-disclosure. Um, Automatic thoughts pop up or flash in your head without conscious thoughts. That's what is called automatic thoughts. And core beliefs are the thoughts that a person has that determine how they interpret their experience. And CBT is a psychosocial intervention that aims to improve mental health. CBT focuses on challenging and changing unhelpful cognitive distortions and behaviors, improving emotional regulation, and the development of personal coping strategies that target solving current problems. CBT is a common talk therapy, and it has been proven to be helpful for a range of problems such as depression, anxiety, PTSD, marital problems, to mention just a few. Self-talk is a technique that involves the change of negative self-statement or automatic thoughts. This is gotten from the ABCs that you're thinking affect how you feel and, of course, translate into your behavior. It helps to boost one's self-esteem. Whereas Socratic questioning techniques is an effective way to explore ideas in depth to help promote independent thinking. The self-disclosure technique is a planned use of therapy's personality, insights, and perceptions as part of the therapy process. The self-talk approach is appropriate for this case because it will increase the client's self-esteem and confidence. The Socratic questioning was chosen because it will help the patient pursue thoughts of different directions and uncover assumptions of why he feels he is not being liked. Whereas the self-disclosure will foster empathy and strengthen the therapeutic relationship. So that's the way I chose it. I chose the self-talk first, followed by the Socratic questioning, followed by the self-disclosure techniques. And the overall encounter that I want with this patient is to get the patient motivated and to believe in himself again, so as to start applying to go for interviews and eventually get a job. And an example of how this CBT can be used to support culture is by adapting CBT to the patient's culture and beliefs. We psychiatric mental health nurse practitioner needs to know that when we're doing therapy, we need to incorporate the patient's beliefs and also their culture. So, for example, since my patient is an African American male that believes in spirituality, he's a spiritual African American. So, in this section, I'm going to be adopting prayer into each CBT section and also scriptures. So, those are the things that he believes in. So, I'm going to adopt that into his own work and also, during therapy. I'm not going to be able to show this into therapy, but these are the things that I will put in mind when I'm doing therapy for this African American male. The summary of expected probably conclusion is to eventually use the self-talk to get the patient to believe in himself and change that negative thought to positive ones. That is, I'm good enough. The Socratic questioning will also help the patient to stop negative assumptions of I'm not liked to I'm likable. While the self-disclosure is to get the patient to see that trying helps to get solution, and the overall is to get him to apply for jobs and go for interview. Thank you so much. And the three steps will be showed in 3 different videos that will all be showed on YouTube. Thank you so much.